This is called a Bobad bed, specially designed for neuro conditions. This is more suitable for those patients whose lower body is not functioning. So this is a Bosu ball. This is an active passive cycler, which is an automated cycling unit. This is agility trainer. This is specifically designed to make use of games where patients don't feel bored. This is a forearm trainer. So this can be used for multiple muscles in multiple angles and multiple axes. Hi, I'm Uday Deja, Senior Physiotherapist and Administrative Head for Rehab Operations for Brinnova. Today we are at our Kodapur facility and we're going to give you a short tour on what services we provide and what you should look for when you are choosing a rehab center for your pre and post hospitalization requirements. So for ease of understanding, today we're going to demonstrate and show the Department of Physiotherapy. So this is the Department of Physiotherapy. Here we bring the patient twice a day. Morning and evening session will be delivered to them. And the duration of therapy will be around 45 minutes to 1 hour based on the patient's requirement. Usually we bring in the patient either in wheelchair or stretcher as per their condition. And we start with this. This is called a Bobad bed, specially designed for neuro conditions where the patients can't move. All the passive movements, the stimulation of the body, making them sit, all the mat activities will be performed here. So this is called tilt table, where the patient will be made to lie and this table will slowly rise up so that the patients start feeling their own body's weight and then they will feel more comfortable with their body. Those who can't move and those who don't have any sensation, this will help them with ease of control in the body slowly as they develop and as they progress. This is called a transito unit, which facilitates movement of a patient from sitting position to standing position. This is more suitable for those patients whose lower body is not functioning. This is an active passive cycler, which is an automated cycling unit, which will facilitate the cycling action of the patients. We'll make the patients come and sit here. Therapist will be operating the unit and they'll set a preset speed and a preset resistance, which the patient has to match and overcome, which will help in understanding the joint action. So this is agility trainer, where the patients will practice coordination. Patients' trunk balance is hindered. Most of the times, they won't be able to control their torso. For those, we'll make them sit in the wheelchair. And those who have adequate balance but have coordination issues, for them we make them stand and ask them to practice this. This is specifically designed to make use of games where patients don't feel bored and they start using their upper body for reaches. And it also helps with partly coordination. So part of balance training, once they achieve good body control and once they start walking, we increase the difficulty level. So this is a Bosu ball where, as you see, one of my therapists is practicing balance, the other is supporting. As part of gait training, you can see one of our therapists is demonstrating how we induce obstacles and we try to control while they walk. Also check how their balance is while turning and make sure when they get discharged, they walk home back with all ease and control. This is a forearm trainer where we can increase and decrease the resistance and train the forearm muscles for performing the actions of supination and pronation. This is a multi-use pulley system. Right now the therapist is training the triceps. So this can be used for multiple muscles in multiple angles and multiple axes. This is a shoulder wheel, which helps in increasing the range of movement for the shoulder. Usually patients with periarthritic shoulder or a frozen shoulder, they have decreased ranges. For them, this is very much useful. As you can see, the therapist is doing the action in standing. We can do the same in sitting. Here you can see our therapist making the patient do gait training with the help of a suspension unit. This unweighs the whole weight and makes it easy for the patient to walk. The therapist carefully plans the number of steps and how the patient needs to execute that. It also helps with turning, sudden changes in direction, and also control the body balance when these actions are done. Here, part of the occupational therapy, the therapist is training hand function as well as hand gripping. So these are weighted pegboards. Thereby patients start feeling the weight in their arms and their grip improves. Here, as you can see, part of the gait training program, our therapists are using walking aids. Here, a rollator is being used, which supports the whole body, and here a walking stick is being used, a quadruped stick. So this helps gain confidence for the patients, and they are more comfortable. And this is part of our hand rehabilitation. This is called a Cyribo, which helps with the hand function. It is to retrain the hand grip. And now you can see one of our speech therapists is working on the oromotor complex, trying to help the patient in learning how to swallow. This is our ICU facility. You can see dedicated ventilator setup, and we have all the requirements. Also, we have a major OT where decannulation or tube changes, these procedures are taken up. Brinnova tries to bring as many innovations as possible to brighten the future of all the people who come here. At Brinnova, we make sure all new innovations are utilized and we deliver the best to the patients. Thank you.